Snoring is annoying, but sleep apnea can be dangerous. Many times you can't treat one of these conditions without addressing the other. Fortunately, both conditions are treatable, as we learned from Dr. Stephen-Seink from Hoag Memorial Hospital Presbyterian Sleep Disorder Center in Newport Beach.
When a person is snoring, there is vibration of the tissue in the back of the airway. This can happen for several reasons. There is physical obstruction somewhere along the airway, whether it be the nose or the throat. For example, the nasal passages can be congested due to allergies, and this can cause narrowing of the airway. Other possible causes in the nose can include nasal polyps and a deviated septum. Now, in the back of the throat, there can be excessive tissue from obesity. It can also be caused by relaxation of the muscles that hold up that tissue in the back of the airway. This loss of muscle tone can be related to things such as alcohol, sedatives, or it can be a part of normal aging. Snoring can be treated. Usually the first treatment is conservative measures. This would be, first off, weight loss. If there is excessive tissue in the back of the throat, losing weight will definitely decrease the likelihood of snoring. Avoiding alcohol and sedatives, including sleeping pills, will decrease the chance that the tissue will relax and block the airway. If there is a nasal cause, such as the nasal congestion, treating the nasal congestion with things like nasal steroids or antihistamines will help. If there are nasal polyps or a deviated septum, surgery can help. For more serious cases, surgery can be done to remove some excessive tissue in the back of the throat. People do come to sleep clinics for snoring. Sleep clinics can look for other possible causes of the snoring. Pure snoring alone may not be dangerous or harmful, but if it's related to other sleep complaints such as difficulty falling asleep, difficulty staying asleep, or sleepiness throughout the day, snoring may be a sign of a more significant sleep disorder. At the Hoag Sleep Disorder Center, we see patients with a wide variety of sleep disorders. These disorders range from sleep apnea, insomnia, restless leg syndrome, narcolepsy. There's a wide variety of clinical disorders we see. Sleep apnea is the condition where you have pauses in your breathing when we sleep. The three types of sleep apnea are obstructive sleep apnea, central sleep apnea, and mixed sleep apnea. Obstructive sleep apnea is the most common type. With obstructive sleep apnea, the tissue in the back of the throat relaxes and blocks the airway. During these periods where there's blockage of the airway, you essentially stop breathing. With central sleep apnea, there is not blockage of the airway. What happens is that there is a lack of a signal from the brain to trigger the muscles to initiate breathing while sleeping. Untreated sleep apnea can lead to high blood pressure, coronary artery disease, congestive heart failure, and stroke. There are various treatments for sleep apnea. Generally, we begin with conservative treatments. If the patient is overweight, a small amount of weight loss may improve their symptoms. Avoiding alcohol and sedatives near bedtime can help with sleep apnea. If these conservative measures do not work, we look for other possible treatment options. One is positive airway pressure treatment. With this treatment, the patient wears a mask over the nose or mouth, and air is forced in, and this actually splints open the airway. Though it sounds like it may be uncomfortable, it actually improves sleep. At the Hoag Sleep Center, we have 3 dedicated sleep specialists. We have multiple technicians available, both to do the sleep studies and during the day for mask fittings, for those patients who do end up with positive airway pressure treatment. A person should have a sleep study done when there is that suspicion that sleep apnea is present. Snoring alone may not indicate sleep apnea, but when patients complain of excessive sleepiness during the day, frequent nighttime awakenings, these may be signs of a more significant sleep disorder.